Progesterone pills do something that no other form of progesterone can do. They protect your uterus, they help you sleep, they calm anxiety and reduce depression. They may even reduce your risk for breast cancer, especially when they're compared to synthetic progestins like medroxyprogesterone. Safety, uterine protection, mood, and sleep. That about sums up progesterone oral capsules. I'm going to show you why progesterone pills taken by mouth at bedtime are not only effective, but probably the safest form of progesterone for women in menopause. So let's start with the S in SUMS, which is safety. There's strong evidence that oral micronized progesterone and not synthetic progestins like Provera, progesterone is associated with a lower risk of breast cancer. A large population-based study showed that synthetic progestins increased breast cancer risk by 28%, but oral micronized progesterone saw no increase at all. A meta-analysis of multiple studies where they're all pooled together found that women using estrogen plus micronized progesterone had actually a 33% lower breast cancer risk compared to those using estrogen plus progestins. And these aren't isolated findings. Multiple systematic reviews and cohort studies point all in the same direction. While we don't have randomized controlled trials that directly compare progestins with progesterone, but when the observational evidence is consistently showing lower risk with oral progesterone, that's a safety signal that's really worth paying attention to. The U in SUMS stands for uterine protection. If you're taking estradiol and you still have a uterus, you need something to counteract estradiol's effect on the uterine lining, which is to cause it to grow. Oral micronized progesterone does that effectively, safely, and with fewer side effects than the synthetic options have. The standard regimens are 200 milligrams of progesterone for 12 to 14 days a month, which is called sequential, or 100 milligrams every day at least. As long as the dose is right and you're consistent, progesterone pills help prevent endometrial hyperplasia and endometrial cancer. If you've experienced anxiety, panic, or even depression during menopause, you're not alone. Progesterone pills can help, often pretty dramatically, because when taken by mouth, progesterone gets converted in the liver into a metabolite called allopregnanolone. Allopregnanolone works in the brain on what's called GABA-A receptors. It's a system known for calming anti-anxiety effects, something that topical or vaginal progesterone just can't do in the same way. A quick side note, while most women feel better on progesterone, a small percentage experience the opposite. More anxiety, more insomnia, especially on oral progesterone. We'll talk more about that and what you can do about it later. So let's talk about sleep, the final S in our SUMS framework. Women tell me over and over again, I started sleeping through the night for the first time in years once I began taking progesterone pills. It's not just a placebo effect, the research backs that up. Clinical trials show that an oral progesterone dose of maybe around 300 milligrams at bedtime improves deep sleep, reduces night awakenings, and shortens the time it takes to fall asleep. The mechanism is similar to what we talked about with mood, the GABA-A receptors and allopregnanolone. Allopregnanolone is created when you take progesterone orally, and it modulates those GABA-A receptors, promoting a sense of calm and sedation. This effect is unique to oral progesterone. Synthetic progestins don't have any impact on mood or sleep. Progesterone creams and vaginal forms also don't really have much impact on mood and sleep, only oral progesterone. Now, what if progesterone makes you feel worse? As I mentioned, some women experience what I call progesterone intolerance, panic attacks, sleeplessness, or even really dark thoughts. In most cases, that's related to how their brain responds to allopregnanolone, that calming metabolite I mentioned earlier. It's supposed to soothe the brain by activating those receptors, but for a small percentage of women, it seems to do the opposite. Instead of sedation, they get stimulation and they feel awful. It isn't common, but it is very real. If that's you, I would recommend that you not give up on progesterone entirely. One of the keys is to start low and go slow, sometimes with doses as tiny as 12.5 milligrams, gradually increasing over weeks or even months. A hormone specialist who understands this sensitivity or intolerance can help you find the dose that works without the side effects. It's also important to work closely with a compounding pharmacist. You can't get these kinds of doses in commercially available progesterone. Hormone therapy for menopause isn't one size fits all. If you're watching the videos from my channel, you're probably facing a lot of questions. Things like, is progesterone right for me? Am I taking the right dose? Should I be using hormones at all? Well, if you're asking those kinds of questions, I've got a couple of ways I can help. First, if you're already taking hormones, but you feel a little unsure or a little overwhelmed, schedule a hormone coaching call with me, the Hormone Pharmacist. We can take 30 minutes over Zoom, get together, go deep into your symptoms, your lab work, the goals you have for yourself in menopause. Let's help you move forward with clarity without fear. Or if you're still deciding, is HRT right for your menopause or not? Check out my video course. The Menopause Solution walks you through the risks, the benefits, how to start hormones safely and confidently. Become your own health advocate with any doctor. You can find both of those options at simplehormones.com/decision. I'm here to help however I can. Before you go, though, I've got one last video in this series on progesterone dosage forms. It's about a secret hack that some women use when they can't tolerate progesterone oral capsules. It's not necessarily the best method for everybody, but it may be what you need if you're struggling with progesterone side effects or progesterone intolerance, especially severe versions. So if you've had a hard time with progesterone or you just want to know all the options, watch my next video to find out what this workaround is and what it can and can't do. I'll see you there.